So we heard this conference about the STARGLO study with the follow-up of 36 months. The STARGLO study is a phase 3 international trial that included patients with relapsed refractory diffuse large B-cell lymphoma who are ineligible for stem cell transplant. Patients were randomized to receive Glofit-GemOx or R-GemOx, and Glofitamab-GemOx was given for a total of 8 cycles, followed by glofitamab monotherapy for 4 cycles. In R-GemOx, patients received a total of 8 cycles. In this conference, we heard about the 36 months follow-up data, and we do see sustained benefit of Glofit-GemOx at this follow-up with a complete response of 58% compared with 25% in the R-GemOx. And the overall survival remains improved with Glofit-GemOx, and it's actually nearly doubled at about 25 months compared with 12.5 months in the R-GemOx arm. What also was noticeable is there was a landmark analysis done for patients who had a complete response at the end of treatment of Glofit-GemOx, and those are the patients who had remarkable progression-free survival at 74% and overall survival at about 79%. It seems that most of the benefit was more pronounced in patients who had only one prior line of therapy. In terms of the safety profile, there were no new safety signals. The most common side effects were GI side effects as well as cytopenias. In terms of infections, there were more infections with the Glofit-GemOx. The rate was about 55%. In terms of grade 3 to 5 infections, they were more common in Glofit-GemOx at about 33% compared with 11% in the R-GemOx. In terms of CRS, that was about 44% on the Glofit-GemOx arm. Most of it was grade 1 or 2, and ICANS occurred only in 4 patients. So we do see a sustained benefit of the Glofit-GemOx at the 3-year follow-up of the STARGLO study. There was another paper presented, and that was on a subgroup analysis from the STARGLO study, in which patients were stratified by age, as well as lines of therapy and the time of relapse. And what was noticeable to me is there was sustained benefit in all age groups, patients who were less than 65, more than 65, and also more than 75. In fact, in the patients who were more than 75, the median overall survival was about 33 months, and the CR rate was quite remarkable, about 60 to 65%. Regarding the lines of therapy, patients who had an earlier relapse in their second line were noticeable also to have more pronounced benefit in terms of the treatment, with remarkable improvement in overall survival. As far as the safety data in this also subgroup analysis, it was about the same between different age groups. We did see more infections in the patients who were more than 75 years of age. So overall, my takeaway from these 2 studies is there is a sustained benefit of Glofit-GemOx at 3 years of follow-up, and that benefit extended across all age subgroups and lines of therapy, whether it was a second line or a third line, and also whether the patients had early relapse or late relapse after their prior line of therapy.